Person-centered therapy was proposed by Carl Rogers. It is based on the concept of humanistic psychology. Humanistic psychology explains that all people strive for self-fulfillment and self-actualization. These are the goals of person-centered therapy. First, it increases the independence and integration of the client. Second, it is focused on the person, not on the problem. And lastly, it creates the conditions necessary for positive growth. Role of the therapist is also important. First, therapists should be congruent. Therapists should be genuine to their client. Their behavior should be congruent to their emotions. Secondly, therapists should have empathy. It is an accurate ability to view the world from client's perspective. Lastly, therapists should have unconditional positive regard. Therapists should accept whoever his clients are. He should understand and take good care of his client, and no judgmental at all.
The process of therapy are as follows. Client's communication about externals and not self. Client describes feelings but recognize or own them personally. Client experiences feelings in present. Clients trust new experiences and relates to others openly and freely. So these are the therapists should do. They should listen to try to understand how things are from the client's point of view. They should treat the client with the utmost respect and regard. They should be transparent and congruent. A therapist should be a model of a human being struggling toward greater realness. Lastly and most importantly, the therapist should be genuine and authentic without any false front.
If we will look to the concept and purpose of the person-centered therapy, this therapy is trying to resolve the incongruence of the client. It helps the client to accept and be themselves. Basically, there are several techniques used by the therapist, such as listening, accepting, respecting to the client's concern. It is also essential to the therapist that they understand and respond to the client's concern. Eventually, this therapy used in a broad range of people, like people with schizophrenia, and people who suffer from depression, anxiety, alcohol disorder, cognitive dysfunction, and personality disorder. This therapy can also use for individual, group, or even for family therapy. This therapy and the therapists are expecting that the client improve their self-esteem, to trust their inner self and experiences as a source of information for making decisions. They are also expecting that the client will increase their ability to learn from their mistake rather than repeating it, to decrease the guiltness, the insecurity, and the defensiveness of the client so that they can build a positive and comfortable relationship with others. And lastly, the therapists are also expecting that the client will increase their capability to express their feelings. As we observe, the person-centered therapy focused to the client experiences. It means that the primary actors in this therapy is the client, and the therapists are only facilitator during the therapy.